From a disease that turns your brain into a sponge to bacteria that can suffocate you from the inside out, today we're counting down 5 of the deadliest diseases humans have ever faced and what medicine learned the hard way. So let's dive right in. Number 5, polio, the paralyzer. For decades, polio was every parent's nightmare. Not because it always killed, but because it could steal movement from a healthy kid overnight. Poliomyelitis is caused by the polio virus, and it spreads primarily through the fecal-oral route, meaning it's usually picked up from contaminated food, water, or poor sanitation. And here's the messed up part. Most infections don't look dramatic at all. In fact, many people have mild symptoms like fever, sore throat, fatigue, maybe even some nausea or stomach issues, or no symptoms whatsoever. So people could and can spread it without knowing they had it. But in a small percentage of unlucky cases, roughly about 1 in 200 infections, the virus crosses the line from annoying viral illness to something much more sinister. It invades the nervous system. Here's what's happening medically. After entering the body, poliovirus replicates in the throat and gut. Then it gets spread into the bloodstream. In rare cases, it reaches the central nervous system and attacks motor neurons, the nerve cells in the spinal cord and brainstem that control muscle movement. Once those neurons are damaged or destroyed, the muscles they control lose their signal. That's when paralysis shows up, and it often wasn't gradual. A child could be walking around fine one day, and the next they can't lift an arm, stand, or move a leg. That's why it terrified people. It felt random and sudden. If polio hits the neurons controlling the diaphragm and chest muscles, you can't ventilate properly. At its peak in the 1940s and 50s, polio outbreaks caused hundreds of thousands of paralytic cases worldwide every year. And in the United States alone, tens of thousands were paralyzed during major outbreaks. Then came one of medicine's greatest victories, vaccination. The polio vaccine turned a global terror into a near eradicated disease. And today, wild polio is close to elimination, but not gone altogether. It still appears in limited regions, and outbreaks can flare up wherever vaccination rates drop. Number 4, anthrax, death by spores. Anthrax sounds like something pulled straight out of a spy movie. But it's very real, very lethal, and what may surprise you, it's very old. Anthrax is caused by Bacillus anthracis, a bacterium that has a terrifying survival trick. It forms spores. These spores are essentially biological time capsules, dormant, tough, and capable of surviving in soil for decades, sometimes even longer. Heat, cold, drying out, doesn't matter. The spores just wait. And humans don't usually catch anthrax from each other. Instead, exposure happens in 3 main ways. Cutaneous anthrax, spores enter through cuts or abrasions in the skin. Gastrointestinal anthrax, from eating contaminated or undercooked meat. Inhalation anthrax, breathing in spores, which is by far the deadliest form. Cutaneous anthrax typically happens usually during direct contact with infected animals or contaminated animal products. Now, gastrointestinal anthrax, on the other hand, is rarer, but more dangerous. This form occurs when someone eats undercooked or contaminated meat from an infected animal, most often in regions where livestock vaccination and food inspection aren't consistent. After ingesting spores, patients can develop severe abdominal pain, vomiting, bloody diarrhea, and intestinal perforation as the bacteria invade the gut lining. But the version that keeps doctors up at night is inhalation anthrax. This form occurs when someone breathes in airborne anthrax spores, which can happen during industrial processing of contaminated animal products, accidental laboratory exposure, or in rare but high-profile cases, intentional release, such as bioterrorism, which is why it's so dangerous. When anthrax spores are inhaled, they don't immediately cause symptoms. Instead, they travel deep into the lungs and are quietly picked up by immune cells called macrophages. Those cells unknowingly transport the spores into the lymph nodes in the chest, and that's where the real damage begins. So, how do we treat anthrax today? Treatment is aggressive and immediate. For suspected inhalation anthrax, doctors don't wait for confirmation. Patients are started on multiple IV antibiotics, often a combination that includes drugs like ciprofloxacin, doxycycline, and others to cover resistant strains. On top of that, we now have antitoxins, medications that that neutralize anthrax toxins before they can overwhelm the body. There is also a vaccine primarily used for military personnel and high-risk workers, and post-exposure vaccination can be given alongside antibiotics after a suspected exposure. Number 3, yellow fever, the organ melter. Yellow fever is one of those diseases that doesn't just injure the body, it reshapes entire societies. That's because it's a viral hemorrhagic disease spread by mosquitoes, primarily Aedes aegypti. Unlike infections that creep quietly, yellow fever moves in stages, starting deceptively mild before turning outright catastrophic. After a mosquito bite, the virus enters the bloodstream and begins infecting cells throughout the body. Early symptoms often feel flu-like: fever, chills, headache. In fact, many patients briefly start to feel better after the first phase, and that false recovery is what made yellow fever so dangerous. As the infection progresses, it targets vital organs one by one. The liver is hit especially hard, which disrupts bile processing and leads to jaundice, the yellowing of the skin and eyes that gave the disease its name. At the same time, the kidneys can begin to fail as well. From there, the heart may weaken, contributing to low blood pressure and shock. As if that weren't enough, the virus also interferes with the blood's ability to clot. And once full organ failure sets in, mortality in severe cases can reach 30 to 50%. One of the most infamous outbreaks occurred in Philadelphia in 1793, where roughly 10% of the city's population died in just a few months. For years, no one understood how yellow fever spread. It wasn't until the late 1800s and early 1900s that scientists finally proved that mosquitoes were the vector. Once mosquito transmission was understood, prevention finally became possible. Cities drained standing water, installed window screens, and reorganized sanitation systems. And then came one of medicine's biggest wins, the yellow fever vaccine. A single dose provides long-lasting, often lifelong protection. With vaccination and mosquito control, yellow fever disappeared from many regions where it once ruled rampantly. Number 2, necrotizing fasciitis, the flesh eater. Few diagnoses make doctors' stomachs drop quite like the words necrotizing fasciitis. Not because it's common, but because when it shows up, the clock is already ticking. This is something emergency departments and operating rooms still deal with right now in modern hospitals with modern medicine, and it can still overwhelm the body frighteningly fast. Despite the nickname, necrotizing fasciitis isn't caused by a single organism. It's a syndrome, a catastrophic soft tissue infection, most commonly caused by group A streptococcus, but also by bacteria like Clostridium, Staphylococcus aureus, or dangerous mixed bacterial infections. The bacteria usually enter through minor skin breaks, a small cut, a surgical incision, but once those bacteria get inside, things escalate fast. Instead of staying near the surface, the infection spreads along the fascia, the thin but extensive connective tissue that wraps muscles, nerves, and blood vessels beneath the skin. At the same time, the bacteria release potent toxins that do 3 devastating things. They destroy tissue directly, they cut off blood supply to the area, and they trigger a massive inflammatory response that pushes the body towards shock. From the ER standpoint, this is a full-scale emergency. Antibiotics alone are not enough because dead tissue has no blood supply. The only real treatment is immediate surgery. Surgeons have to open the infected area and aggressively remove all the dead and dying tissue. In severe cases, this can mean amputation of a limb to stop the infection from spreading and to save the patient's life. Even with fast diagnosis and modern care, mortality rates range from 20 to 40%. If diagnosis is delayed, the numbers climb rapidly. Number 1, Creutzfeldt-Jakob disease, the brain eraser. This one is different. Not loud, not explosive, just quietly devastating. Creutzfeldt-Jakob disease, or CJD, isn't caused by bacteria, viruses, or parasites. There's no infection in the traditional sense. Instead, it's caused by something far stranger, prions. Prions are misfolded proteins, and unlike normal proteins that quietly do their job and break down, prions do something terrifying. They force other normal proteins to misfold too. One bad protein becomes 2, 2 become 4, and suddenly you have a chain reaction that the body cannot stop. Inside the brain, this cascade of misfolded proteins cause neurons to die. As cells break down, the brain develops microscopic holes, giving it its classic spongiform or sponge-like appearance seen in pathology. CJD often begins subtly. Maybe memory lapses, clumsiness, or personality changes. changes. Patients develop rapidly progressive dementia, loss of coordination and balance, slurred speech, and involuntary muscle jerks. Families often describe watching someone disappear over just a few weeks. Diagnosis is also uniquely cruel. There's no simple blood test. Doctors rely on a combination of MRI findings, EEG patterns, spinal fluid markers, and clinical progression, often confirming the diagnosis when there's nothing left to offer but comfort care. And that's the hardest part. There's no cure, no effective treatment, no vaccine. Families are forced to process a terminal diagnosis that moves faster than grief can keep up with. So here's the takeaway. Some kill fast, some wait, some don't even look alive. And yet, over and over, the biggest breakthroughs weren't flashy cures. They were prevention, sanitation, vaccines, early detection, and respect for biology. If you found this video intriguing, go ahead and check out this playlist right here for more deep dives into the darkest corners of medicine. And if you want part 4, hit that like button and let me know in the comments what other deadly diseases I should do a deep dive on. And don't forget to subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.